The pros and cons that come with hysterectomy, because it's very important for everyone viewing this to understand when should they, if at all, opt for this.
See, today hysterectomies become simple. Most of the time we are doing keyhole surgery, laparoscopic surgery. So the procedure takes an hour and a half. Patient goes home in 1 or 2 days. The stitches are very small, so she recovers well and she's very happy. On the other side, removal of the uterus or the womb alone causes very few bodily symptoms. The periods stop permanently, but the changes in the body or the hormones are almost nil. The only possible negative in removal of the womb only without the ovaries is that maybe the menopause will happen maybe a year earlier because of blood supply to the ovaries. However, if you remove the uterus with the ovaries, the tubes and the ovaries, then there is a dramatic fall of hormones and immediately the woman will go into menopause. Now, if she's 50 years old, it doesn't matter. But if she's in her 40s, then you're cutting down many years of good hormone support which that lady is going to have. And so obviously she will have side effects, including, hot flashes, bone loss, bones will become weak, and all the sort of problems of menopause and aging will happen. However, I do believe that almost any doctor who's operating a woman, say at the age of 40, for some problems, for example, fibroids or, very heavy bleeding, they will never remove the ovaries. So at 40, 45, 47 even, we will not remove the ovaries unless the ovaries are damaged. And so I don't believe that removal of the womb alone is going to cause her too many changes in her body. Having said that, any unnecessary surgery is not recommended. Surgeries come with complications. There are risks of anesthesia. There are risks of surgery complications. And so obviously any surgery, whichever field it may be in, which is not absolutely necessary, should not be done. We should always choose a simpler, safer, non-invasive option given a choice. So that is sure. But that doesn't mean all hysterectomies are wrong. So it's a nice balance that we have to maintain. For cancer, hysterectomy is the solution. For certain patients, they've had already 2-3 surgeries for fibroids, for cysts already in their life. And so as a final resort in their late 40s, a hysterectomy may be the option for them. So it all depends on individualization. One size does not fit all.